March is designated as National Colorectal Cancer Awareness Month. And according to the Centers for Disease Control and Prevention, colorectal cancer is among the most deadly diseases that affect both men and women. This year, it is estimated that about 143,000 people in the United States will be diagnosed with colorectal cancer. Colorectal cancer is more likely to occur as people get older. More than 90% of people with this disease are diagnosed after the age of 50. The average age of diagnosis is 72. Dr. Garth George of Advanced Gastroenterology and Surgery Associates explains how colonoscopies play an important role in early detection.
Colonoscopy screening is extremely important, and I think it's important to note that colon cancer is the second most common cause of cancer death in the country. And most patients are reluctant to have the procedure performed, but it really is a preventable form of cancer, as most cancers are. Colon cancer develops from an ingrowth of the lining of the mucosa, what we call a polyp. And there are certain types of polyps, the ones that are adenomas, that can grow and eventually turn into colon cancer. It's important to note that the adenoma cancer sequence takes approximately 6 to 10 years. So every patient that we see with colon cancer, they've had a polyp growing in them for a long time, which can be prevented because when we do colonoscopies, we remove polyps. Now, of course, there's some colon cancers that may develop a little bit more rapidly, but the average time interval is 6 to 10 years. So it really is a preventable form of cancer. We start screening at the age of 50. And if that person has no polyps, or they have what are called hyperplastic polyps, then the recommended next screening interval is in 10 years. Now, if someone has a family history of colon cancer, then we usually start in the 40s or 10 years before the youngest age of the person affected. For instance, if someone has a family member that was diagnosed with colon cancer in their 40s, then that person should start in their 30s.
For more information on colonoscopies, as well as other treatments and surgical procedures available at AGSA, please click the Colorectal Cancer Story link on our homepage, yourhometownhealth.com.